Hey everyone, welcome. When it comes to our health, and especially our gynecological health, the unknown can really trigger a lot of unnecessary worry. So today, as a healthcare professional representing the MediByte channel, I'm here to provide you with a clear, accurate, and completely reassuring medical overview. We're going to be looking at a very specific, yet incredibly common clinical topic. It's something many women experience, but honestly, very few openly discuss. Welcome to MediByte. Our whole mission here is to empower you with direct, easy-to-understand medical insights. Today, we're demystifying common gynecological abnormalities, specifically vulvar cysts. We're going to separate fact from fiction and replace any anxiety you might be holding onto with pure clinical understanding. Okay, let's dive right into this. Here's our roadmap for today's explainer. First, understanding vulvar cysts, then comparing cyst types, identifying the symptoms, diagnosis and treatment, and finally, joining the MediByte community. All right, Section 1, Understanding Vulvar Cysts. To kick things off, let's do a really quick anatomy refresher. The vulva is the area containing the external female genital organs, and cysts here, they're actually incredibly common. Let's break down the most frequent type you might encounter. Vulvar inclusion cysts. So think of these as small sacs containing epithelial tissue, and epithelial tissue is essentially just tissue from the surface of the vulva itself. While they are definitely the most common cysts found right on the vulva, it's also worth noting that these can sometimes develop inside the vagina as well. Building on that, let's look at the second type, vulvar epidermal cysts. These are similar small sacs, but there's a key difference on the inside. Instead of surface tissue, they contain secretions from your oil-producing or sebaceous glands located right near your hair follicles. You might be surprised to realize the skin down there has oil glands just like your face does, and they act in very similar ways when it comes to things like blocked pores. Moving right along to Section 2, Comparing Cyst Types. Now, what's really interesting here is how we can compare exactly how these two form side by side. Inclusion cysts often result from minor physical trauma. For instance, a small tear during the delivery of a baby can inadvertently trap that surface tissue underneath the skin. Though I should definitely mention, some do just develop completely on their own for no obvious reason. Epidermal cysts, on the other hand, have a totally different mechanism. They develop when the ducts leading to those sebaceous glands simply become blocked. The glands, well, they just keep doing their job, producing oil, but with absolutely nowhere to go, those secretions accumulate right under the skin's surface. Okay, Section 3, Identifying the Symptoms. Look, simply finding out you have a cyst is absolutely not a reason to panic. Let's look at the characteristics of uninfected cysts to understand why. The absolute most important takeaway I want you to have here is that they usually cause no symptoms at all, literally none. They're typically quite small, we're talking less than half an inch or about 1 centimeter in diameter. Visually, they generally appear white or yellow, and for the most part, they just remain completely silent, save for maybe some occasional mild irritation. However, the situation absolutely changes if a cyst becomes infected. Infected cysts can enlarge over time, and the surrounding tissue, it'll become red and really tender to the touch. Practically speaking, this localized swelling may make sexual activity quite painful. This shift in physical symptoms is usually the exact moment most patients will actually notice a problem and decide it's time to seek care. Which brings us to Section 4, Diagnosis and Treatment. So, the crucial point here, what happens when you actually visit your doctor? Well, the great news is that diagnosis is incredibly straightforward. Please be reassured. Diagnosing these cysts does not require complex machinery, intense imaging, or painful invasive procedures. No way. Your doctor can usually just see or feel them simply during a standard routine pelvic examination. If treatment is indeed necessary, you can expect a very seamless timeline. Step 1 is simply a pelvic examination to locate and confirm the cyst. Step 2 involves anesthetic administration for pain management, just to ensure you are entirely comfortable. And Step 3 is the surgical removal of the cyst itself. But listen, there is a vital clinical caveat here. This surgical removal is generally only done if the cyst is actively causing you symptoms. If it's small, uninfected, and painless, your doctor will likely advise just leaving it alone. Now, for those that do require removal, doctors carefully tailor the pain management based on the extent of the issue. It's not a one-size-fits-all approach. If you have only one cyst, the doctor will simply use a local anesthetic injected directly to numb that specific site. However, if there are several cysts that need removal, the approach scales up. The clinician might use a regional anesthetic to numb a larger area of the body, or in some cases, a general anesthetic that causes a temporary loss of consciousness. The entire goal here is to match the pain management to the procedure, ensuring you are safely and comfortably treated the whole way through. And finally, Section 5, join the MediByte community. That brings us to the end of the clinical facts for today's explainer, but certainly not the end of your health journey. Understanding your body is the very first step to lifelong wellness. So what does this all mean for you? Are you ready to prioritize your gynecological health? Knowing what's normal, what's common, and what's easily treatable is wonderfully empowering, and it gives you exactly the knowledge you need to advocate for your own well-being. Thank you so much for joining me for this MediByte explainer. If you found this breakdown helpful, please like, share, and subscribe to the MediByte channel. We are totally dedicated to bringing you clear, structured, and accurate medical overviews to keep you informed and healthy. Keep learning, stay proactive about your health, and we will absolutely see you next time.